Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola here with Pharmacology Declassified with another Fast Facts Pharmacology Edition. Well, this one's about the treatment goals for diabetes. You know, we all talk about A1C and FBS, and I'm like, well, what does all that mean? So, we know that glycated hemoglobin, A1C, is a biochemical marker of the average blood glucose levels over the preceding 3 months. What the heck is a glycated hemoglobin A1C? Well, you have plenty of different subtypes of hemoglobin, and the A1C subtype is the one that's most easily glycated. So, in other words, the one that sugar sticks to the easiest. And as a result, we can use that as a measure of what your average blood glucose has been over the course of time, in this case 3 months. So, an A1C of 7, for example, is equal to an average of 154 milligram per deciliter blood sugar over the last 3 months. That qualifies you as diabetic. Now, people say, well, why do I get so stressed out about this A1C number? Realize that we know that each 1% reduction in your A1C really equates to a 40% reduction in the risk of long-term diabetes complications. Okay, so what my goals might be, Viola? Tell me what I need to look for in my blood work. Well, we know that if your A1C is between 5.7 and 6.4, you're pre-diabetic. And anything over 6.5 is considered diabetic. So, wow, the guidelines have gotten a lot stricter now. Your A1C has to be less than 5.7 to really qualify you as non-diabetic. Well, 5.6 or less, technically. But I want to just take my fasting blood glucose. So what does that number have to be? Well, we say anything under 114. So fasting blood glucose of 114 or less is considered, regular non-diabetes. Anything above that would be considered pre-diabetes or diabetes. All right, well, now that we know that diagnosing diabetes is all about blood sugars, then you would think that the focus of pharmacologic treatment would be on altering blood sugar. And indeed it is, and mostly it's involving insulin. We know that insulin is a hormone that we produce that lowers our overall blood sugar, but creating insulin is the problem. Over the course of time, since diabetes is a progressively degenerative disease, you lose the ability to make insulin. Now, in the beginning, we thought the treatment for that would be to give you medications like the sulfonylureas to help you squeeze more insulin out of your pancreas. And then we realized that that's not the case at all. That type 2 diabetes, as we're referring to, is really a problem with insulin resistance. You don't have too little insulin, you have too much insulin resistance. And so the drug of choice for that would be a drug that boosts insulin sensitivity. And of course, that means metformin, right? So metformin, the only biguanide we have currently, does a good job in boosting insulin sensitivity and at the same time decreasing glucose production from the liver. Okay, now metformin's awesome. Why? Because it has very few side effects. Mostly it's GI. It has a very low cost. It's available generically. But the greatest part about metformin is if you take it right, it helps you lose weight. Well, I can't think of a better positive reinforcement for taking my medications than losing weight along with it. But, it does have disadvantages, such as the fact that hypoglycemia is always a risk, lactic acidosis, and also can't really be used in patients with existing renal impairment and liver dysfunction, which sometimes come along with diabetes. Along the way, we did get other drugs called the glitazones, Actos and Avandia, which Actos is still around, but they never really rose to the level of acceptance as metformin did, because metformin just seems to work for about everybody that takes it, and the downside to metformin is very low considering the upside. So that's why it seems like the entire world's on metformin, and there are other drugs to treat diabetes as well, but we're going to talk about that in our next edition. For now, my friends, thank you so much for joining me. This is Tom Viola with another Fast Facts Pharmacology Edition. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care. creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.